now everything is visual, right? The surgeon is not able to feel what's inside the patient. So a lot of groups are working on that. We as a group are the first ones to do this, to explore the autonomous angle, right? To perform these tasks autonomously and see, how can we do this with minimal human intervention.
When the surgeon is using the tools, they're not able to actually sense when the tool contacts tissue. And for the surgeons, they have years of experience that allow them to correct for that. However, when you're operating autonomously, we aren't able to translate that sort of experience directly into robot algorithms. And so we have to find ways that we can account for our lack of sensing in our autonomous algorithms.
In terms of future projects would be, what are the other complicated tasks that we can perform? So we're talking to surgeons about what are the difficult tasks that they do. For example, peeling a vein or an artery, peeling a vessel is something that surgeons spend a whole lot of time on. And can we use the robot to do some of this?
And this includes things like using the vision system to detect when and how things are changing, which is difficult because often the tissues that you might be manipulating can change their shape. They can change what they look like because they're covered in fluids. And then as well, the tools are shiny, which makes the estimation process more difficult for robots. So the motors for the robot exist in the back, and then there are cables that snake all the way through the robot to drive the joints on the tool. And the problem with that is that these cables can stretch, there can be slack in there, so that when you turn the motor, the joint doesn't actually turn. These kinematic errors we found are a primary source of difficulty in doing surgical autonomy.
A human in the loop is also another focus because we don't want the surgeon completely out of the loop, right? The surgeon has a lot of input into how the robot would work. And so what are the best interfaces for how a human surgeon can specify the task that the robot needs to perform? Right now the robots are, for some of the tasks, are twice as slow as humans. For other tasks they might be even slower. Right? So can we ramp it up so that it's comparable to how a human does surgery?